My disclosures are up to date. I do have a conflict with the implant, but not with this specific technology that we'll be discussing. So when we think about tools to improve shoulder arthroplasty, there's three main categories. There's preoperative planning software, there's patient-specific guides, which Julie will tell us about, and then I'm going to focus mostly on augmented and mixed reality. But before we do that, this is a case, pretty straightforward, 81-year-old chronic shoulder pain, pseudo-paralytic, documented full thickness rotator cuff tear. I think everyone in the room would agree if this patient failed non-operative treatment, we're going to go ahead and do a reverse. So we put it in our 3D planning software. There's lots of different companies out there. This is a particular one that I use, so we can virtually implant different size glenospheres. We can dial in the lateralization, the overhang, the inclination angle, and this is all CT driven. So we pull in the DICOMs and we can see very much where the implant's going to sit, where are we going to get purchased. And I think we can all agree that this is something that we employ in our practice, and this is something that's important. Check range of motion and just try to optimize implant positioning. But the question is how do you take this information and then actually execute in the operating room? And that's really the challenge, because we can all look at the plan ahead of time. We can devise a great plan, but how do you actually execute it in the operating room? And then there's cases like this, more challenging cases. So a lot of bone loss. We can see posterior medial erosion, and in this case, I actually put it into the 3D planning software, and we can see without a bone graft, we're going to have very little bone contact, only 26%. So we're going to go ahead and plan a bone graft for this case.